Are you sharing, sir?
Yes, I'm sharing, but somehow some. Am I off? Am I seen there or am I off?
You are visible on the screen, sir. You are very visible, but screen is not visible as of now.
I'm not understanding why it's happening.
So maybe you can try sharing once again.
I will try sharing once again. Is something visible?
Yes, sir. Now it is visible. You can put it in slide show mode.
Okay, just a second. Some window is disturbing me. I will just check.
Yes, sir.
Is it okay?
Yes, sir. Yes, sir.
Okay. So at presented, say. So the topic I've chosen is current scenario and future perspective of medical microbiology. Let me bring greetings from SDM College of Medical Sciences and Hospital Dharwad, and of course from the city of Dharwad. Stanley Plotkin, the famous vaccinologist, most of us have referred to the vaccinology book by Plotkin. He said that 3 great discoveries of medicine in the last 200 years. Pardon me? Hello, pardon me?
Participants, kindly mute yourselves. It is disturbing the flow of the talk.
3 great discoveries of medicine in last 200 years are antisepsis.
जोर मारते नहीं हम बैंकिंग मैनेजर हैं तो हम पूछ लो ऐसे समझो फिर भी वो किया नहीं वो लोग मालूम ही नहीं है उन लोगों को
Some disturbance.
Somebody by name Arpita, please mute yourself. Kindly mute.
Hello.
I think you can continue, sir. I've requested them to mute. Suresh sir, I think you're on unmute. Suresh sir, can you please mute, sir? There is some disturbance from your end. Thank you, sir.
So if Plotkin knew about AI and microbiome, he would have definitely said, added those 2 discoveries. Okay. The current trends and future perspective, which I have taken up as a topic for discussion today, this is my own thoughts, some thoughts. Okay. And I don't feel that everybody should agree with that. The current trends and future perspective. What is the future of laboratory medicine considering the horizon of just 15 years? Okay. So advances in knowledge tools, especially knowledge tools, are happening at a very fast, breakneck speed. The current happenings have been unimaginable, at least to my generation. Okay, we never imagined that things could, this will be there waiting for us in the future. I started my career early in the early 80s, and it was still an era, I can say, of partial microbiology. Traditional methods of laboratory diagnosis were in use, and time-tested laboratory applications were available. Things had started rolling, but it was sluggish. A little advancement had occurred. For example, the complement fixation test was phasing out. ELISA was coming in, but it was slow. and that was one of the favorite theory questions in our PG examination. And many of my contemporary PGs have never seen an ELISA machine. Okay, the field of medical microbiology was struggling to create its own identity. Even in the clinical fraternity, medical microbiology was a non-clinical subject. Forget paraclinical. If they were considering it as nobody used to consider it as a clinical branch. Okay, and the other stakeholders also never bothered about medical microbiology. The another important thing that the word stakeholders, which is a sort of a commercial jargon, this commercial jargon also had not come in the field of microbiology those days. Nowadays, we are having redundant terminology, especially commercial jargon has come in the subject in a big way. The scenario suddenly changed with HIV. A huge new pool of technology was closeted in high-end research laboratories suddenly was open to the tertiary care laboratories. ELISA, ELISA readers, cutoffs, etc., were the woke terms in fashion those days. And with HIV pandemic, infection control became a keyword. In conferences, barrier protection, disinfection, disinfectants were getting special attention. Infection control started getting recognition, and in fact, I would jokingly say, funnily say that the new species of microbiologists mutated as infection control specialists. Two powerful thrusts changed the scenario completely. In 1990s to even up to 2000, PCR came in diagnostic microbiology.
Sir, may I interrupt you, sir?
Yes, please.
Sir, his slides are not moving.
Is it?
Yes, sir.
Now, can you see the slide?
No, we are seeing the first slide, sir. It's not moving.
Is it?
Yes, sir.
What about this now?
No, sir, it's not moving. The first slide itself is visible.
Oh my God, then what should we do?
Sir, you can put it in slideshow mode and try, sir.
Slideshow mode?
Yes, sir.
सर एक बार बाहर जाके वापस आ जाओ सर.
I have to quit and come back?
Yes, sir, you can try doing that, sir.
That's better, sir.
Okay. Till now, the first slide is being seen. Is seen. Hello, Sneha.
Yes, sir.
First slide is seen.
First slide is
Yes, sir.
seen. You just have to put it in slideshow and
I'm putting full screen.
yes, sir. Can you move the next slide, sir?
Check. Do you see the next slide?
Not yet, sir, but the first slide is also not visible. I think it's moving.
Just check.
Nothing is visible, sir. It's a blank screen which is visible right now.
Okay.
It is visible in this mode, sir, without slideshow. But once you
Okay.
shift to
Okay.
slideshow mode, there is some issue.
Okay.
I think you can.
Okay, I'll go to normal view.
Yes, sir.
Is it
Yes.
visible?
Yes, yes, it is visible, sir.
All right. Thank you.
Thank you, sir.
Hope this window is not.
The slides are now visible, sir.
This window which I am seeing my own face, this is not will disturb you. Hope.
No, sir, not at all.
Do you see my window or you can see only the slides?
We can see both, sir, now.
We can see both.
Both. Okay.
Yes.
Okay. So this we have discussed now. Medical. So it's when HIV pandemic came, and then two powerful thrusts we saw PCR and human micro, followed by sequencing technology. Actually, what happened that PCR was the mother of human microbiome, and because of PCR, it was able to come to declare human genome in the beginning, as around 2000, in the beginning of the next millennium, 2001, that human genome project was complete, and it was declared that we have say explored the human genome and we can map it completely. But Joshua Lederberg, the Rockefeller University Nobel laureate, he said that unless and until you complete human microbiome, it has no meaning. And he was the first to tell the world that human microbiome is equally important. And then came COVID. Why these marks are there, I don't know. I have not moved anything here. Anyway, COVID-19, was it a boon to medical microbiology? I don't know. But when human microbiome was there and everybody was speaking about human microbiome, and we are still, of course, working on that, COVID-19 came. And that was the first pandemic we have seen. It was the first pandemic after the century. And we have seen this pandemic, this kind of pandemic for the first time. Right in the beginning of this pandemic, two Indian scientists, bioinformatics studies, expressed that and showed that the SARS-CoV-2 has an element of HIV. So that was a great doubt. And what was the origin of the virus? Was it a laboratory constructed virus? We still have, say, a lot of speculation, a lot of doubt about it. Not only microbiologists, epidemiologists, and other people, geneticists, they have their own doubts about whether it was a laboratory made virus. And hereafter, we don't know, we should be prepared as microbiologists for this. So that is lurking for us in the future. Okay. But the real blow, coup de grace, came from artificial intelligence. Now, where is medicine today? If we consider about medicine, I can, without any hesitation, say that medicine has been completely hijacked by engineering and technology. Humans are getting replaced by machines. That is the stark reality facing at you. The even of today, forget about the future. Mechanical engineer, computers, imaging, ultrasound, electricity, electronics, optics. So in every field of medicine, these are the things which are driving the medicine further. This I am not talking about tomorrow. For example, just think of chemical engineering. All our tests, especially immunochromatographic tests, who has made it possible? It is because of the chemical engineers. ELISA, the enzyme systems, given substrate, colorless to colorful after breakdown, who has given us? Chemical engineers. So technologies are the transformative technologies. We should not consider that it's an onslaught. They are almost unstoppable. Okay, computer science is coming in a big way. Bioinformatics is going to be very important science for the field of microbiology also, not only for other fields. Okay, mechanical engineering, the precision in mechanical engineering is making the machines extremely accurate. All these things are driving the medicine. With nanotechnology, chemical engineering, etc., we can see tremendous advances in the future. So far, machines have been there, they are helping us. Currently, they are driving medicine, but now we are in flux. Machines are becoming intelligent. They are into decision making. So, in this new era, I really congratulate the postgraduate students for taking up their career in microbiology. It's a strategy. Okay, microbiology is one of the few living sciences. Every day something new, something exciting is happening here. And there is a lot to come. And those who will enjoy these developments will try to approach them with a positive mind. They have a great future and enjoy what they are doing. Okay. Say, MD is just a platform. When you do your PG, 5 or 6 basic disciplines like bacteriology, virology, mycology, etc., they are taught to you. And previously, that was the end of the learning, and they used to start their career. Now, career begins after MD. Now, the not specialization, the career which you want to choose will begin after MD from one of those topics, or maybe a little beyond that. And so, at the end of the MD, you also must be having the question, what next? The future is little nebulous here and very difficult to address this question at this point of time. Teaching and diagnostics, two streams are available for us. For you, multiple streams are available. This lecture, please don't mind the seniors. I am focusing basically towards the postgraduate students. A very few lucky took up the third more exciting and satisfying option in our times, and they went into research. See, what about teaching? Teaching is still a great option. Teaching, when I started my career as a teacher, teaching technology was discussed in the 80s, early 80s, late 80s. But now it has become mandatory for the teachers to have a proper training in teaching technology. Without that, their confirmation will not be there, with their promotions will not be there. There are some very, very important developments happening. However, we upcoming microbiologists and teachers, especially teachers, are burdened with some unrealistic expectations in the form of syllabus, in the form of curriculum design. So they are little unrealistic, which I personally feel. We are borrowing Western ideas, principles and concepts. Okay. And those Western ideas are brought into medical teaching, which there is no harm in bringing Western ideas. If they are good, they should be brought from anywhere. Okay. But they are unfortunately replacing some of the best practices we had in the traditional teaching. A lot of good ideas are there. where lot of very expectations are there. They are not, say, in the core, they are not bad, but they are not implemented. So this is one of the important things. And in spite of all the jitteries, teaching is a wonderful career option. So those who want to wish to take it up, take it very positively. It's a good career option. Okay. Now, practicing as a microbiologist in the future, it is not just finding a sensitivity report or identification report or a titer of a serological test. Okay, it is going to be beyond that. Wonderful work of some of the stalwarts in the field, they have showed us the path. And truly speaking, MDR pathogens are driving the change in the attitude of not only microbiologists, but the entire medical fraternity. Their attitude is changing. Take any science. The attitude is changing because of MDR pathogens. We have realized the ability of these organisms. In medicine, we honor seniority. And I always feel that, yes, that's right. Seniority is very important. When you get very good gurus, you become a very good microbiologist. Okay. So these microbes are minimum 3 billion years senior to us. We have to respect their seniority. Okay, so to practice with them. So for example, identification of Enterobacter. Identification of microbes is important, has been told to us by the so many organisms. So previously, what we used to VP citrate positive, gram negative bacillus, we never used to bother for motility, just say Klebsiella. That's not enough because the antibiotics are going to be different for the treatment. Intrinsic resistances are going to be different. So why identification of pathogen is important is revealed to us, and we are trying to understand it. And that is why acquisition of bench work, skill, wet laboratory skills as well as knowledge is very important if you want to be a practicing microbiologist. Who is a microbiologist? No microbiologist, however intelligent, however knowledgeable, well-read the person may be, unless and until that person is an excellent technician, we cannot call that person a microbiologist. A microbiologist has to be first a very good technician, and then he is a microbiologist. Okay, say knowledge is at your fingertips. Now, I don't say field knowledge, but at least information is at your fingertips. At postgraduate examinations, this is one of the sad experiences we have. That we go to the examination, and when we look at the technique of the students are well prepared. They work hard. I don't say that they don't work hard. They work hard. They are well read. But when you look at the techniques, as a observer, I have some sad feeling, and I feel that this boy or girl has wasted 3 golden years of opportunity in his life. That is not going to help you in the long run. Wet laboratory techniques are still extremely important. Theoretical proficiency has less value. Information is at fingertips, and that AI consultant sitting in your laptop or computer is there to guide you for each and everything. But if you continue that like that, one day that AI consultant sitting in the laptop is going to make you obsolete. This is not fear mongering. This is the stark reality which is staring at you. This is a walk-away specimen processor. This is already in existence. There is no need. Okay, these things can be integrated with AI. Your presence will not be needed at all. These things already, right? Just give the sample, it will culture. It will spread it on the plate. Okay, do smears from the colonies, everything which you want. This is going to do. This is already existing. It's an Italian machine. Okay. So hereafter, expect huge change. It is not going to be that simple. Scenario is changing completely. Will the current diagnostic laboratories exist? I have my own doubt. But the way we have laboratories, these laboratories, will they exist? I'm really not very sure about it. Okay. Sorry. The laboratories are going to be decentralized. Okay. Point of care testing is going to take over. Home-based lab tests will be available, and most of the tests which you do routinely in your laboratory, and they are bread and butter tests. And those tests will be point of care tests, even available at the at their house. Pregnancy test is another great example. In biochemistry, so many tests come. In microbiology, CRP also has come. So home-based tests are there. And a day is coming that the huge developments in this nanotechnology, ultra sensing, image identification, all these things, and uh, spectrophotometry, thermosensing, all these things are going to becoming miniaturized, and I will not wonder if 25 years down the line, a person will carry his own mobile laboratory in the pocket. Okay, that will be a lab in your pocket. The person will give a strip of saliva to the machine, or maybe a very minuscule prick on the finger, and the mobile in his pocket, or maybe a small desktop model in his office, will churn out a report of 250 tests. How many tests you do in your private laboratory? 50, 100 tests in microbiology laboratory. This will churn out 250 tests of different pathology, microbiology, biochemistry, all. And not only the test, the machine will tell you how many steps you are supposed to walk today, what things you are going to eat today, how many hours you are going to sleep today. All these things are going to be AI driven. And with this kind of miniaturization and ultra sensing platforms, these things are definitely going to be there at the end of 25 years. Who had thought about multi-top platform? We used to do our biochemical reactions, setting up the biochemical reactions, performing 15, 20 reactions for identification of one organisms. We used to prepare the tests. We used to have maintain positive, negative controls. All has gone for a toss. A thing like multi-top at a throwaway working cost will provide you a report in 15 minutes. So we never imagined that the identification of organism can be in this manner also. We used to handle fluids in milliliters. After HIV came and ELISA developed, it became microliter. Now picotiter plates are there. Microliter is 10 raised to minus 3. Picotiter is 10 raised to minus 12. Pico is 10 raised to minus 12. And this minute quantity of serum samples will be handled and reports will be provided. So can you imagine the thrust which is there? But we should take it up as Alice in Wonderland. If you do not have exclamation and appreciation for these things, you are going to lose the battle of being in microbiology. Things are there. Things will be pressing you to the wall, but they are exciting. Let us accept them. Okay. Research field is widely open. Humans still have a power to score over AI because imagination, human analysis, perception, creativity, intuition, interpretation, these are yet to be touched by AI, and it will take a long time for AI to touch it. So to make yourself future ready, you have to develop skills. And skill sets, just you cannot say, oh, why should I develop skill? Automation is unstoppable. That statement is meaningless. Okay. If you have a boat you must have to have oars to the row the boat. You have to learn something additional. One needs oar to row the boats. Your degree has provided you a boat to sail. So you have to learn something new. Learn a computer language. Learn something in addition. One needs oars to row the boat. So you have to learn so many things. What you are supposed to learn, we are going to address. This is for new upcoming PGs who are entering in the field arena. Automation is unstoppable? Yes, it is unstoppable. But what is the difference between you and technician if everything is automated? Say, so what are the machines going to make you convert you into just a technician? So think about that. Okay, role of microbiologist is evolving. You are going to be part of multidisciplinary clinical teams. Okay, it's no longer going to be your island in the laboratory, working there 9 to 5 and going at home at 5 o'clock. It's not, that luxury is not going to be there for you anymore. Okay, say a clinical microbiologist. So about drug resistance. Now, because of the drug resistance, the clinicians have understanding that yes, something like there is there. For example, Proteus and IAMM resistance. General statement like indol positive Proteus will be IAMM producers has no meaning. How the clinician will understand which are indol positive Proteus? So there are so many unfamiliar names which are checked out because of by the MALDI database or your VITEC2 or face system identification database. Many unfamiliar names you have heard for the first time. Forget the clinician. So when you are learning that particular thing, so think about it. You must have your own background study before you generate the report. You have to give a curated report. For example, this is a Pseudomonas aeruginosa. I am not supposed to give the cephalosporins here, important cephalosporins. Okay, so which clinicians feel important are not important for Pseudomonas. It is intrinsically resistant to them. So unless until you give curated report, it has no meaning. So go to wards, attend rounds, and become part of a treating team. Advances in mycology, like any science, they are fabulous. Disproportionately expanding incidence of type 2 diabetes is there. Advances in medicine are driving maybe more greater incidence of fungal infections. Okay, so this is a perception paradox. Oh, I always feel like that microbiology has been considered for a long time as an alien science by medicals. They do not consider that it's a odd man out for them. Okay. And mycology is considered alien by medical microbiologists. So this has to stop. Colossus personalities, if Colossus personalities like Aruna Roke, Dr. B.M. Hemshetter, Dr. Jayanti Sayadu, Dr. Shiv Prakash Payanu, they can't inspire you, then you really need to retrospect. Okay? And we must be proud of them. 4 of them are Kannadigas. Pandemic of the century, yes, COVID-19, it was disastrous and catastrophic. All right. But we achieved some unprecedented success. We can't forget the relentless effort by people, like there are many, but let us say, our Karnataka. Tremendous efforts, relentless, by Dr. V. Ravi, who fought against all the odds. Apart from that COVID time, he has already done amazing work in encephalitis. He's an example of hardcore research and administration. Both can be blended. So it's not that if you are into research, you cannot do this. Multidisciplinary approach and multifaceted approach you have scope if you have that approach. Okay. Microbes, if will be weaponized, I feel that viruses will be weaponized because it is very easy to manipulate virus. We know that a fully designed, constructed, fabricated virus exists. Okay. We have so new methods to identify those biowarfare agents as quickly as possible will be developed. Impedance PCR. This is the one we have tested. We have tested in our department. Okay, it was being developed by a commercial company, and what happened that they demonstrated us. We challenged that particular machine with our own isolates, and this machine gave pakka positive result without any ambiguity, just in 10 cycles of amplification. So this things like this are going to come up. Aptamers, this is the thing which is very close to my heart. We are currently working at SDM on aptamers. This is a joint effort with one other prestigious institute, but a lot of work actually is being done in our laboratory. What are aptamers? Aptamers are single chain nucleic acids. They fold on themselves and they undergo conformational, which shape changes. And these shape changes become complementary to some targets or antigens. And once they become complementary specifically to some targets, they work like highly specific antibodies. For example, this is a single chain nucleic acid. It can fold on itself. So these aptamers fold on themselves. For example, here this is a folded aptamer. See, this is a single chain nucleic acid which has, and by chance, this is an accident. Okay, by chance, it has become complementary to this target, and they can avidly come together like antigen antibody. Okay, because they are perfectly complementary to each other. This is a less known field. It is less explored, but it has enormous potential. A lot of approaches are under investigation for rapid, accurate, easy, and cost-effective identification of pathogens with the help of aptamers and with so many other techniques. Okay, so with all that, see, for example, just one point about aptamers I will tell you. These aptamers are so small, less than 10,000 Daltons, so they are non-antigenic. So very easy to use them inside the body. Two commercial therapeutic aptamers which are injected in the eye are already marketed and approved by FDA, US FDA. Okay, so they are there, they are going to be there, and they are going to be very helpful us, at least in the diagnostic area. This aptamer and so many such things are going to escalate the diagnostic efficiency to a great, steeply high level. Okay. Another success, COVID vaccine, 19 vaccine we produced in India. World refused to give many things to us, but our scientists, and they were microbiologists, they worked very hard and we produced vaccine. We did not only buy vaccine, we did not only produce, but we supplied it to the world and showed what is in there. Some countries were pressurizing us to buy some vaccine, mRNA vaccine, but our government told that you experiment those vaccines, show the results in our population, in our experimental settings, then we will accept it. They were not ready. And now you go back and check Google for those vaccines. There are a lot of negative things about those vaccines. Even companies have accepted their fault. Okay, so this is what we are changing. We are changing for good. Okay. So we have, say, this was just developing vaccine. Okay, but what was there? We vaccinated more than 200 times doses were given, and all that record is meticulously made. We have which person received vaccine, where that person received vaccine, who was the nurse
तुमचा खटा
injecting,
कर दो मास्क का पहले सकता
who was the person who injected the vaccine, and all that was a meticulous record. And that is why those who have not seen movie Vaccine War, I urge them, just go to any say audiovisual platform, check commercial platform, this movie Vaccine War, wonderful movie to see. Okay, what we gained from the COVID-19 experience? Not, we are not inferior to anybody. We are all Homo sapiens.
Lion, a people that rises up as a lioness and as a lion.
We are all Homo sapiens, and nobody is higher and nobody is lower. Okay, our minds are colonized because of that British era. Okay, so we feel that we are different and the other world is different. This is the Western world. We have to decolonize our mindset, develop pride for our nation. And when I do this statement, mind you that this is evidence-based statement. This is not just a say thing in coming out of thin blue air. Okay. Many postgraduates have an aspiration to go abroad. Recheck and reassess the decision. News about West is not all that good. So it's better to really assess the place we are going, situation not only in that institute, situation around, and then finally take a decision. Otherwise, God may forbid you don't have to come back as you go and you're repatriated. Things like that should not happen. India now is a country of opportunities, and many thinkers all over the world, they are thinking that growth story is being written in India. Okay. Infection control has become almost a specialty. Now it's a highly demanding field. Infection control also is now showing that signs of encroachment or taking over by AI. Surveillance yet is far from being replaced. Surveillance, you still depend a lot on that. But we should understand that those bacteria, 3 billion years senior to us, have defeated us. We don't have any luxury of multiple potent antibiotics anymore. And that is why we have realized, entire medical fraternity, administrators and government also, they have realized that infection control, dedicated infection control is the only thing. How you maintain your record, how you do infection control, how you demonstrate it. Okay, your record is going to save you. Tomorrow patients are going to pull you in the lawsuit. That time infection control records only are going to save you. So infection control itself has become an excellent specialty. Okay. Antimicrobial stewardship, I have a different opinion. Opinions may differ. Let me tell you categorically, it's not our domain, not a domain of microbiologists. We are members of the team. Okay, giving well-curated antibiogram, working, implementing excellent laboratory techniques, and giving opinion, that is our domain. Okay, antibiotic stewardship is a domain of clinicians. We use antibiotics on microorganisms. Clinicians use antibiotics on patients. They are supposed to know antibiotics stewardship. Okay, it's not our domain. That is what I feel. Okay, and this is what is the feeling of some of the very top seniors in our fields. Antibiotic policy again is a teamwork. Okay, so for example, you have antibiotic policy. It's not again your responsibility. You develop antibiotic policy. Fine, you have a lot of knowledge about how antibiotics work, how bacteria respond. You do that. But many times what we have seen that it remains on the paper because you don't have the capacity to implement it. Those who have the capacity to implement antibiotic policy should be responsible for it. However, otherwise, you have a fantastic antibiotic, extremely well prepared antibiotic policy based on your say data. But it is like having money in the mirror. You see the money in the mirror, you cannot use it. So a well-prepared laboratory professional will be important, and he will be important in clinical decision making. You have an enhanced role in clinical decision making. Lot of policy developments you will be doing, you will be participating in that. Okay, but policy development is going to be a very general approach for all the population, okay, or groups of population. But is the medicine going to remain like that? Not at all. Now you will have to take an individual centric approach because medicine is going to be personalized. Okay, whole genome sequencing. You, me, and for a patient, we may have to do our own or a patient's whole genome sequencing once in a life. Maybe at a particular age which is decided by the geneticists. You have to do it once in life. Once it is done, it is permanent. Hereafter, what will happen? The genome-driven personalized treatment decisions will be there. There will be apps. There will be some guidance from your, say, AI, which will give you decisions made on your genome, based on your genome. Okay, right now, for example, which antibiotics you can take, which antibiotics you should not be given. If one antibiotic you are given, if you are a fast acetylator, the number of doses will have to be increased. Okay, the quantity of medicine has to be increased. Okay, it's not only your kidney which will decide how much antibiotic will be excreted in body. So many other things are there. How much protein binding will be there? Which type of proteins you have and which antibiotic they will bind to that. This is what is going to be a personalized medicine. Right now, CRISPR-based diagnostic platforms like Sherlock, Detect TR, they are available today. And with the coming years, it is going to develop to a very exquisite level, very top level. Okay. So if you are dealing under the not I would say not influence, but under the on the guidance of your whole genome sequencing, personal home genome sequencing, then bioinformatics is imperative. The bioinformatist, if you want to become one, personalized medicine is waiting for you. Early diagnosis, even before symptoms develop, you will do that. Okay, depending on some parameters, or your that whole genome sequence analysis will tell you that it at this particular age, in this scenario, this particular thing is going to be triggered. This person is going to land up in diabetes at this particular age. Thereafter, you can have infection control measures for that, individualized infection control measures for that person. This is what will be pharmacogenetics. For example, sepsis in comorbid conditions. Which patient will land into cytokine storm? You will be able to predict because of the metabolic fingerprints and cytokine profiles. Okay, cloud labs are going to come. The digital cloud-based lab networks will be there. Several hospitals across different cities will be just catered by a few laboratories. Okay, and that is why the right now what microbiome, metabolome, and immune profiling, these are the elite terms. But these are going to be in the common fashion and day-to-day usage tomorrow. And when you want to have good, I would say, when you want to have good relation with the AI-based applications in the future, you have to take a lot of efforts to learn that. Your efforts, AI has no substitution for that. You have to take your own efforts. Okay. Now the sorry, the test-centric laboratory medicine will be replaced by patient-centric laboratory medicine. So you, as a new upcoming microbiologist, prepare yourself to take challenges. You know, survival of the fittest. If you make yourself fit for the future, you will survive. Familiarize with data science, bioinformatics, genomic medicine, interpretation of multi-omics report. So it is you are going to be part of multidisciplinary teams. It's not that you will be mastering all these together, but at least one of them, apart from your being a medical microbiologist, you have to try to master to be a part of the multidisciplinary clinical teams. Your role as a laboratory physician is over. It is all hijacked and taken over by the machines. Okay, so diagnostic focus, precision, personalized medicine, predictive medicine, AI, next genome sequencing, they will all be handled by these cloud-based labs, and the laboratory medicine is going to be drastically changed. Okay. So I wish to conclude, just a minute. So this is what I wanted to say about the current perspective and future scenario of medical microbiology, and wish all of you, especially the upcoming postgraduate students, a very, very good luck. Thank you very much for this fabulous opportunity. Once again, thank you very much.
So thank you so much for such a lucid talk on a topic so crucial and important. Now, I request the participants, if they have any questions to sir, they can either put it in the chat box or they can ask directly. And before that, I would like to welcome our National President, Dr. Nagmurthy sir, who joined a little late, but he's there with us since a long time. Thank you, sir.
So thank you. It was a great message for all of us.
Thank you very much. In fact, that slide about the currently how we are driven by engineering, I had prepared that slide almost 8 years ago, and that I had used in one of my talks. So that was the time, 8 years ago I had prepared, and now since then I have been thinking about all this. But recently, my whatever I had thought, the things have gone much beyond that.
Sir, few pearls that I can, re-quote from your talk, that be a clinical microbiologist, and then what you rightly said, you have to be really good at the technical skills to become one. And learning really starts after MD. It's also true. And I will definitely agree with you that we have to upgrade and learn a computer language. So we are no longer doctors. We need to, probably pitch into the engineering field as well. That is really relevant, sir.
Why I always feel that lab skills are so important? Because hereafter the machines are going to replace you. But you as a microbiologist will be, many of the PGs who will be aspiring for different careers, if they go to private companies, they will have to recheck on the wet lab on
Sir, you're not audible, sir.
To understand microbes, and that's why I feel that a lot of thrust has to be given on bench work. Okay.
Any questions from the participants? If not, please kindly unmute yourself.
So if there are no queries,
Yes, I think there are. It was very clear, I guess, so that's why there are no questions.
oh my
Or
God,
our
thank you.
PGs are probably too shocked to, take it all at once that they have no questions.
See, my effort was not to frighten anybody, but this is the reality. And if you know the demon, you will be able to say handle that situation better. But it is going to be exciting.
Sir, there's one query in the chat box. Second year MBBS students ignore microbiology compared to patho and micro. Why?
There is a lot of echo. I'm not able to.
Yeah. Sir,
See, somebody has to answer. Yeah. Please tell me.
Sir, there's one, very curious query in the chat box. Somebody has asked, sir, why are second MBBS students preferring patho and micro and ignore, sorry, patho and probably some pharmac probably, and ignoring microbiology?
Dr. Satyanarayan, you are not audible.
Sir, yeah, am I audible now, sir?
Yes, yes, yes.
Sir, no, there's a query in the chat box. Second MBBS students ignore microbiology compared to patho. So they want to know why.
See, this is because of the, personally, I feel that because this is because of the traditional approach or view about microbiology in the medical field. People have just really recently. I had an opportunity to go to Belgaum to participate in one of the IAMM conferences, and there was a discussion on antibiogram reading, and I really found that the clinicians were so interested in it, and they wanted to understand what it is and what questions they should ask the microbiologist. Okay. I have learned so many things. Let me proudly take this name. It's not correct to say escalate anybody, but let me proudly say that I've been discussing with Sudhindra for some time, and I got so wonderful inputs from him. Made me realize so many things. So people who are working in the microbiology laboratory, if they apply themselves to generate the report, then they will be able to produce a curated report. If they have contemplated on the report, they will be able to discuss with the clinicians. Just printing a report, machine printing the report, you're also not needed there. And your laboratory information system will send the report on directly to the clinician. Where are you needed? So thinking about the report, curating the report, putting your opinions there, this is so important. And I feel that as a microbiologist, we should understand that this is the art. And once this will be known to the clinicians, I feel there will be some influx of students in microbiology. So that traditional approach to the microbiology of our fraternity has to change. And it is changing.
Thank you. Any other questions? Okay, there is a message in the chat box again. It says when 90% of the students have taken Marrow or some other subscription online class and they don't listen to the class, what is the role of a teacher in a microbiologist? And there is a reply saying that maybe because we are not effective in teaching. Any
See.
take on this, sir?
See, this is not a false statement. As teachers, we have to understand that our role is good. When I deliver a lecture in class, the same lecture I sometimes see more effectively, more emphatically, in a better fashion, is delivered by somebody else and it is there on the YouTube. This I see. Okay, ways of learning are changing. If we do not accept it, and if we confine ourselves to that typical British classroom model, that's a wrong way of learning. There were so many things which we wanted to learn our way we never were allowed to do that. Okay, now students are really open. Avenues are open, access is open. They have their own thinking. They see much more than what we could see around us today. And so we are not, we should stop them from doing that. They are going to take help AI. They are say audio visual aids which are available freely. And why not? As a teacher, we should just see that they are hitting the right websites. There are some very, very bad websites which give utterly false information. So we should be part of their learning with them. I feel that students' role of a teacher is coming down. So the way we have been traditionally teaching as a classroom model, and most of the times it was a monologue, this is going to change.
Yes, sir. Agree with you. And same is the opinion uh, by other faculty as well, who say that small group discussions are, better way of teaching. And some people have also opined that maybe pathology and pharmacology are more relevant than microbiology. I beg to differ here. I think the onus is on us to make it relevant. Maybe we are not teaching it in the way that the relevance is well expressed. I think we shouldn't blame the students. We should blame ourselves if that is a message conveyed.
This is another, say, here on this platform, it's not nice to say this, but the kind of curriculum changes which are there, which have been thrust upon us. Okay, the way which we are teaching microbiology was little different. Now it has been completely made syndromic. Okay, and that is not the right way to teach microbiology, in my opinion. Okay, the way we were teaching was also not correct. Lot of whittling down in the curriculum was necessary. But instead of making it step by step better, so kind of drift we wanted, drift has not, it is a shift. Okay, and that is without consultation of a microbiologist. A few people sitting somewhere in the top at the helm of affair are governing and dictating things without having compliance from their other senior colleagues. I don't feel it's a very good, nice thing to do. And that is one reason that pathology, pharmacology, and microbiology are slightly differently appreciated by people.
Yes.
Students.
Okay, so I think many of the questions are answered and we had a good discussion after the presentation as well. May I now request Dr. Suchitra Shenoy, Professor and Head Department of Microbiology, KMC Mangalore, who's also the co-chair of Masterclass series, to give her concluding remarks. Madam, please. Satya, I can't see Madam. madam is there on the.
In the beginning, she was there. I saw her.
Yeah, but now I am not able to see.
Probably logged out.
Yes, I think so. May I request Dr. Satyanarayan to do the honors?
Pleasure. Thank you so much. Sir, first and foremost, thank you. We are honored to have you for the inaugural session of Masterclasses being organized from the Indian Association of Medical Microbiologists Karnataka chapter. So it's been a real insightful talk and probably very inspirational for all of us. I wouldn't say only postgraduates, even the other microbiologists who are listening to your talk. We have been inspired to a great extent, and one of the things which probably would be a takeaway for me is that we need to reinvent ourselves to keep ourselves very sort of in the market rather. Okay, and here I would also like to thank Dr. Jayanti Savio, Dr. Suchitra Shanai, who have been the chairpersons for the masterclass sessions. Dr. Nawaz, who is the president, and Dr. Parimala, the vice president. Dr. Sneha, thanks for convening the sessions, and Dr. Sneha will be carrying forward all the sessions henceforth. And this will be in coordination with the zonal coordinators who have been given the task of coming up with topics relevant to the master classes and coordinating with district, the medical colleges at different institutions, different districts. And I request all the postgraduates and faculty to kindly come up with topics which would be fruitful for them so that we can have relevant sessions in the future. The next session will be on 29th. This will be on the fourth Friday. The details of the session will be put up in the due course. But in the meantime, I would also request all the participants to kindly give in their feedback as well as to give their thoughts about the future topics for the sessions. The one last thing which I would just try to emphasize is that the tagline which we have had for the masterclass is encourage, educate, enable, and empower. I think that is the the motto of the masterclasses as we take it further. Sir, thank you for. It's been a very auspicious beginning, and we had around 125 participants for this session, and I'm sure the numbers will go up as the sessions keep moving. Thank you so much.
Thank you.
Thank you.
Sincere heartfelt thanks to everybody. Dr. Nawaz, Dr. Parimala,
Nagmoti sir, thank you so much.
and Dr. Nagmoti, everybody, thank you very much.
So thank you, sir. It was such an extensive talk, and it would have been an eye-opener for the PG students and as well as the other people who have attended. And personally, I'm very happy that it got inaugurated with your talk first, sir. Thank you so much, sir.
Thank you so much for your kind words.
Sir, actually, there are two more questions which I think are important and I've asked by PGs in the chat box. One is about aptamers, whether it is in research or it is available for practice. And second thing is how, as a PG, they can learn all and work at the same time. Should they do basic work in the first year and come up with learning the extra things in the second or third year? So how should they go about? And about the question about aptamer, if you could answer, it will be really helpful.
So this is specific to aptamers?
One question is specific to aptamer, sir, whether it is only in research or is it available for diagnostics. Second question is in general from a PG, sir.
See, few aptamer based diagnostics are already available. Okay.
Yes, sir.
But more than that, two aptamers for endothelial proliferative disorders of the eye are actually in therapeutic use. For a diagnostic, they will be available, but they are available for therapeutic use, and two have been approved by the American FDA. They are in use. So, unfortunately, this is a place or field of microbiology or molecular biology, which was not seriously looked upon. This started in 1980s, but in spite of that, a lot of aptamers are there. but there are some glitches which are making it difficult for them to bring into reality in diagnostic area. But with the modern technology, a lot of things are solved, and in a recent future, we are going to get aptamers. See, aptamer is one thing, but whether the aptamer has bound to the target, that aptamer and target reaction will be sensed by apta sensors. And those apta sensors are being developed now, and it has become extremely easy compared to the past these days because of this fluorescence-based technique, calorimetric-based techniques, nanotechnology. So this is making it, and even electrical technology, electrode technology, sensitive electrode. It's making very easy. And apta sensors are going to be in the diagnostic in the recent future.
Yes, sir. I hope the question is well answered. And about the second question, sir, like where they, how can they go about learning and working at the same time?
See, as long as you are doing your MD, where is the question of working? You are working as a postgraduate student. If you are working as a postgraduate student, if you want to learn something extra, you have to draw time in the evening. Okay, maybe over the period of 3 years, even 1 hour or 2 hours per week, if you attend some class, some go to some private institute to learn a language or to learn about some AI app. So that will help you. And once you are in one domain of this kind, other gateways will quickly open, but that you have to consider after you earn your MD. By the end of MD, you have to specialize, or you have to at least learn every one domain. Okay, and learning a language will help you to develop your own small apps. In the beginning, you introduced me that I am a flutist. Okay, I won't call myself flutist, but I love flute. And as of today, every day, at least 1 hour in the evening, I practice. So if you have desire to do that, you can do it. This is what I feel.
Yes, sir. I totally agree with you. So it has to be managed simultaneously, and they should not call it as working. Rather, it's continuous learning where you learn in different modes, maybe by reading, maybe by hands-on. Yes. Okay, if there are no more questions, I think we can conclude the session, and we meet again on the 4th Saturday of this month with a new topic, which I'm sure will be beneficial to one and all. Thank you. Thank you for patient listening, and thank you, sir, for that wonderful talk once again. Thank you.
Thanks a lot.
Thanks, everyone. Thank you.
Can I go off the screen?
Yes, sir. Thank you, sir.
Thank you.